Nurses are the front lines in the fight against coronavirus, risking their own lives and health to save others. And as you can imagine, the job takes a serious toll right now.
CBS 13's Laura Hafley's live at Kaiser Roseville with a day in the life of a nurse during the coronavirus pandemic. Laura?
Well, there's no doubt that nurses across California, nurses across the whole country are experiencing really long and difficult days, but that doesn't mean much coming from me. I want to introduce you to a nurse I spoke to who works at Kaiser Permanente at Roseville, working to save lives despite what that means for her own.
And this is the first time in my career I've been a little scared for my own personal health and safety.
And what's worse, her patients can tell.
I have heard them say that they've noticed that the nurses look scared, which is not something I've ever heard in my career before.
33 years as a nurse, Joanne Mwali works in the rooms of patients who have infectious diseases like COVID-19.
We're coming in and taking care of patients that have something that's infectious that we could actually get and potentially die from.
But she says the bigger worry is spreading it to the people she loves.
I tell my family not to come around me.
She says the hospital's got some face masks, gowns, and protective gear, but she'd feel better if they had access to more.
I'm not sure that I'm fully protected when I go to work.
Kaiser Permanente says they are aware of the demand for proper protective gear, writing in part, "We are working with our supply chain vendors and other sources to be prepared to meet the needs of our staff and patients." But Joanne says that's not good enough.
Preparing for the emergency during an emergency is not how we should be doing it.
Nurses here making it clear that they do believe Kaiser Permanente is falling short when it comes to providing that protective gear, the face masks, the gowns, the gloves. But despite not having enough of that, they're going to continue to do their job.